Hello and welcome. My name is Chris Rowena. I'm the lead communications analyst with Health Workforce Development at HCAI. We're so glad you could join us today for the MediCal Behavioral Health Scholarship Information webinar. We're excited to share more about this important opportunity and walk through the details of the program. Just a quick look at today's agenda. Go through a housekeeping introduction, followed by some opening remarks and an overview of what HCAI does. Then we'll go into the MediCal Behavioral Health Scholarship Program, talk about the webinar objectives for today, give you an overview of BH Connect as a whole and how the Workforce Initiative fits into that. Then we'll get into the details of the scholarship program itself, followed by a time for questions and answers. And then we will finish today with some closing remarks. I'll just jump into the housekeeping. Before we begin, I'd like to go over a few notes to help you get the most out of today's session. Number one, we are hosting this webinar in Zoom. Your controls are at the toolbar at the bottom of your screen. We'll be using the Q&A feature today, which can be found in that toolbar at the bottom. And you can type your questions at any time and submit those. We will be moderating questions, so don't be confused if they don't show up immediately. We're doing that just to make sure that we are organized in how we answer your questions today. And lastly, today's webinar is being recorded and will be available on our website within 7 to 10 business days. Now it's my pleasure to introduce Angela Branch, the Behavioral Health and Policy Section Chief here at Health Workforce Development, to share some opening remarks.
Thank you, Chris. Hello, everyone, and welcome. We thank you for joining us this morning for this informational webinar. It's my pleasure to welcome you all to this space. As Chris said, my name is Angela Brand, and I am the Section Chief over our Behavioral Health and Policy branch here at HCAI. Today, the MediCal Behavioral Health Scholarship Program overview is designed to give you a little bit of information about the program as a whole, eligibility, how to apply, information that you can share with your students. This scholarship program is designed to support students pursuing careers in behavioral health. Behavioral health treatment can greatly improve quality of life, helping individuals develop healthier coping strategies and manage life stressors more effectively. As representatives of colleges and universities, you play a vital role in connecting students with opportunities that can shape their future careers. We have a lot of information to get through today, but we will have time for questions at the end. So if anything comes up, we invite you to actively engage with our team. So let's get started. I'd like to start by grounding us in HCAI's vision and mission. At the highest level, our work is about creating a healthier California where every person, no matter where they are, has access to equitable, affordable, and high-quality care. Our mission is the engine behind that vision. We expand access by strengthening the health workforce, supporting resilient facilities, and providing the data and insight needed to serve communities well. Next slide, please. HCAI works across 5 program areas, as you can see here: facilities, financing, workforce, data, and affordability. The workforce section is what we're talking about today, where we invest in programming that expands and diversifies California's health workforce for underserved areas and populations. Next slide, please. HCAI is committed to expanding and developing a health workforce that reflects the diversity of California and meets the needs of MediCal members and underserved communities. So how do we do that? We invest in the workforce, and we administer funding that supports education, training, and placement, especially in underserved areas, while also tackling critical workforce shortages and inequities. Our work targets current and projected workforce gaps to help ensure access to care in communities most in need. And we do that through data-driven decision-making. HCAI publishes comprehensive, actionable data on California's workforce that informs policy, guides investment, and measures impact. And why does this matter? Because a strong representative health workforce improves health outcomes, increases trust in care, and ensures a more equitable access for those across California. Next slide, please. So today we'll be focusing specifically on the MediCal Behavioral Health Scholarship Program. This is one piece of a much larger statewide effort to build the behavioral health workforce. And our goal today is to walk you through the program, its alignment with BH Connect, and share how you and your organizations can help us reach eligible applicants. Next slide, please. Okay, so we'll move to a quick overview of BH Connect and the Workforce Initiative. Next slide, please. So BH Connect is California's major behavioral health transformation effort. It's a coordinated strategy to expand access to care, and as part of that, strengthen the behavioral health workforce. The Workforce Initiative is a core component designed to ensure that we have enough trained practitioners to support the entire care continuum. In mid-December, California received federal approval from the Center for Medicare and Medicaid Services, or CMS, for the Transformative Behavioral BH Connect initiative. BH Connect grows out of our understanding of the lived experience of Californians with behavioral health needs and data-driven analysis of available services. We received this approval, which unlocks the ability to redesign and modernize the behavioral health system by expanding access, improving quality, and supporting community-based behavioral health services and evidence-based practices to members living with behavioral health needs. Next slide, please. So the BH Connect Workforce Initiative will support the training, recruitment, and retention of behavioral health practitioners to provide services across the continuum of care within the MediCal safety net, serving MediCal members and the uninsured. Between 2025 and 2029, in partnership with the Department of Healthcare Services, or DHCS, HCAI will invest up to $1.9 billion in workforce programs. Recipients of this funding will commit to serving MediCal members living with significant behavioral health needs for 2 to 4 years. It's also important to note that the state does have flexibility in this funding. So after demonstration year 2, the state may distribute up to 30% of the Workforce Initiative funding across programs. And we'll talk about those programs on the next slide. So there are 5 programs that HCAI administers under the BH Connect Workforce Initiative. Together, these programs create a comprehensive approach to expanding our workforce and providing a more responsive system of accessible care. The scholarship program is what we're discussing today and is one of those key investments and directly supports individuals entering or advancing in the behavioral health field. 2 of these programs have launched already: our MediCal Behavioral Health Student Loan Repayment Program and our MediCal Behavioral Health Residency Training Program have already launched, and the remaining programs will launch early next year. So without further ado, I'm going to go ahead and pass it on to Andres, who's going to walk us through the ins and outs of this program.
Thank you, Angela. Hi, everyone. Good morning. My name is Andres Gonzalez, Health Program Specialist with HCAI and serving as the policy lead for the MediCal Behavioral Health Scholarship Program. I'll be walking us through a quick program overview, including what it funds, who's eligible, and a few key dates for the upcoming cycle. So next slide, please. So the overarching goal of the scholarship program is to expand the number of behavioral health professionals working in MediCal safety net settings by supporting individuals who are pursuing behavioral health degrees or certifications. In other words, the scholarship is intended to support students with completing their education to enter behavioral health roles where MediCal members need care most. Next slide. So for the upcoming cycle, launching in February 2026, we have up to $96.9 million available. Individual awards may be as high as $240,000, depending on the profession. These award levels and virtually all rules established in the BH are established in the BH Connect special terms and conditions, which are part of the federal agreement we have with the federal government to administer these workforce programs. And also a note that if a profession delivers MediCal covered behavioral health services in a MediCal safety net setting, it may also be considered under program rules. We'll be going over those eligible professions on the next slide. So this slide covers the professions eligible for scholarship support. The program covers a pretty broad set of behavioral health roles, which include alcohol and other drug counselors, peer support specialists, certified wellness coaches, community health workers, promotores, and representatives, clinical social workers, clinical psychologists, marriage and family therapists, professional clinical counselors, licensed psychiatric technicians, vocational nurses, nurse practitioners, occupational therapists, physician assistants, and registered nurses. Next slide. So this slide shows the maximum award tiers and the corresponding service obligations. In that first tier, we have the nurse practitioners and physician assistants. Those are eligible for up to $240,000 and carry a 4-year service obligation. In that second tier, we have a set of licensed and allied health professions. All those professions are eligible for up to $180,000 with the 4-year service obligation as well. And in that final tier, we have the AOD counselors, the peer support specialists, wellness coaches, and the CHWPRs. And that has a maximum award amount of $120,000. However, their service obligation length scales with the award amount, which we'll cover in a little bit more detail in the next slide. Next slide, please. So this slide breaks down the details a bit more clearly. So first, for that licensed and prescribing behavioral health practitioners, as well as licensed associate level pre-licensure practitioners, the service obligation is always 4 years, no matter the scholarship. For non-licensed, non-prescribing practitioners, the obligation depends on how much funding they receive. So awards of $20,000 or more require 4 years of service. Any award between $10,000 to $20,000 will lead to a 3-year commitment, and awards under $10,000 come with a 2-year service obligation. Next slide, please. So all service obligations must be completed in a MediCal safety net setting. These include federally qualified health centers, community mental health centers, and rural health clinics. The program also recognizes hospitals and other behavioral health settings that meet specific payer mix thresholds. So for example, hospitals with a 40% or higher Medicaid and or uninsured patient mix, and rural hospitals with a 30% threshold. Next slide. So other behavioral health settings is a pretty broad category that covers a wide range of sites. For purposes of today, I won't be reading through the entire list, but will emphasize that all these settings must meet the MediCal payer mix requirement that was mentioned on the previous slide. And all these examples will be included in the grant guide for reference when applying. Next slide. So scholarship funds are restricted to education-related costs. Specifically, funding can only be used for tuition and mandatory fees and for textbooks and supplies required by the program. Funding cannot be used for living expenses. That includes both on or off-campus housing, nor for childcare, transportation, or any cost that's not directly related to the program coursework. And I will also note that scholarship payments are made directly to educational institutions, as the funds cannot be provided to individual participants per the STCs, which are the standard terms and conditions. Next slide. So a couple of key dates for this cycle. The application opens on February 2nd, 2026. That application deadline is March 16th, 2026 at 3 p.m., so about a 60-day window. Award notifications are anticipated sometime between June and July of next year, with an anticipated start date of August 2026. And with that, I will pass it over to Chris.
All right, thank you so much, Andres. As you can see, your team has put a lot of thought and effort into this program already, and we're thrilled that you have joined us today to learn more. My camera, there we go. Now going to transition to our question and answer session. To ask a question, please use the Q&A feature located in the Zoom toolbar at the bottom of your screen. I see some of you have already done that. Thank you. You can submit your questions at any time. So we're going to begin answering them now. And let's start with our first question. Says, hi, so current MSW students would not be eligible and only be eligible once they pass the LCSW exam. Is that correct?
Hi, yeah, thanks for your question. I'll take that one, Chris. So current associate level social workers would be able to qualify as long as they're working towards licensure. So once they graduate, as long as they're working in an eligible setting and completing those hours and verifying with HCAI that they're working towards that licensure, they are eligible to apply.
All right, thank you, Andres. Shirley asks, is the service obligation full-time, part-time, or just 4 years for 240 and 180?
So the service obligation would be full-time. I believe that's 32 hours or more. That information would all be verified in the grant guide, but it is a full-time position for the 4 years.
Right, thank you. Laura asks, are family nurse practitioners eligible or only psychiatric mental health nurse practitioners?
So as long as the nurse practitioner is working in an eligible setting in a behavioral health role, they would be eligible to apply. Of course, they would just need to verify that they're, completing that requirement of the standard terms and conditions of actually serving in a behavioral health role in a setting that qualifies.
All right. Let's see. Next question. Do students apply for the scholarship program individually, or does the school apply on their behalf?
Yeah, great question. So students actually apply individually for the program. And then, of course, we'll work with the universities to ensure that the funding is routed directly to them so that they can distribute it, as students won't be receiving the scholarship directly, but the student will be the one to apply for the program.
All right. Thank you. Next question. Can a student who has received a BH scholarship in the current year in their first year of MSW study apply for this new scholarship?
So the student cannot have a current HCAI scholarship, cannot be a current HCAI scholarship recipient. However, if yeah, we are still working out the terms and conditions there, but if they've already had a scholarship, they are not going to be eligible to apply.
All right. Thank you. Next question is, I'm a current MSW student and currently work for a school district. Would I qualify?
As long as the setting is qualifies for what was defined in the eligible settings and the other settings, that would be an eligible setting. Uh, but of course, it has to meet that specific payer mix threshold for us to actually consider it eligible.
All right. Next question we have is, will there still be other programs to fund MSW students while they are in school?
Yes, those programs will still be available. Yeah, but this is, of course, is one particular avenue that they can use, but there will be other programs that continue to fund MSW students.
All right, thank you. If the funds are only available for tuition and not living expenses, it seems like this scholarship fund would be less likely to attract students from underrepresented groups, and also like the funds would disproportionately go to students from private universities with higher fees.
Thank you for your note. Yeah, unfortunately, we are tied to the special terms and conditions that we have with the federal government. Definitely hear those concerns. Unfortunately, we are tied specifically to funding those expenses tied to education related costs.
Megan asks, what is the role of the college in supporting students receiving these funds? I think it was said the funds go to the college directly.
Yeah, great question. So we'll be working with the third vendor party to help facilitate the distribution of funding to the universities and colleges. So we're currently scheduling meetings and trying to get a better understanding of how that process would look, but we'll work directly with each college and university to distribute those funds directly to allow them to then distribute to the students as what works best as far as distributing those scholarships.
All right, thank you. Do school social workers qualify? To clarify, I'm an MSW program or starting an MSW program in January to be a school social worker. Does this meet the requirement for applying?
So MSW is definitely an eligible degree for the scholarship program. Again, it really does depend on the setting as far as meeting that payer mix threshold and specifically being geared towards a behavioral health setting. So as long as those conditions are met, they would be eligible to apply for the program.
Cassandra asks, can a school social worker apply if they are medically billing?
Yes, as long as they're applying to school and going into that role, they are eligible. If they are medically billing, they would qualify like any other social worker.
All right. This question asks, I'm confused about the professionals lists. This seems to indicate applicants must be licensed, but this is applying towards tuition costs.
Right. Great question. So we do fund those programs, and I think someone had a similar question earlier. So those associate level, professionals who are working towards licensure would still be eligible to apply as long as they're working towards that license. Again, totally, it's fine for anyone applying towards school and working as an associate level professional while they work towards that.
All right. Jane asks, can the 4-year obligation be in different eligible settings?
Definitely, yeah. So as long as it's qualifying under a eligible setting from the one listed, it would be totally acceptable for them to work and complete their obligation at that setting.
All right. Another attendee asks, I'm a bit confused by the response about eligibility. You mentioned that they must be associate level working towards licensure to be eligible, but students won't be eligible to get their ASW number until after graduation. How would they be funded if they are no longer students?
So the student would apply for the scholarship, complete their education, and they're given a grace period to find a job and then apply for the relevant associate level certification that they would need to actually go and work. So as long as they're finding a job, applying towards whatever accrediting body they need to actually go and perform their work, they would still be eligible. So again, we do give a grace period for students to get all that in order for them to find a job and practice.
All right, thank you. Next question asks, can I qualify if I already completed my commitment for a past HCAI scholarship?
A great question. Yes, as long as you're not, still performing a service obligation while applying, and that was just a previous scholarship, then you would totally be eligible to apply for this scholarship program.
Right. Next question, would doctorate students be able to apply as well?
So doctorate students could apply depending on the profession. So as long as that it's one of the eligible professions that we've listed in the deck, they would be eligible. So yeah, totally, you'll be able to verify that on the grant guide.
All right. Can students access this scholarship while in school working towards their AA and earning HCAI hours?
Yes, they can.
Okay. Let's see. Um, Next question. Can international students apply?
International students may apply as long as they're meeting all the requirements listed in the grant guide.
All right. I think we may have skipped the question. Let me see. One second here. Well, I guess not. All right, here we go. Um, do you expect this program will last one single year because all the funds will be dispersed in 1 year or one cycle?
No, so we'll be having multiple cycles of the scholarship program. We expect at least three different cycles lasting through 2029. So it won't be just the single year. We have a couple of distribution years left.
Chris, I found the question that was skipped that you were referring to.
Thank you.
The question was, does the educational institution have to be verified by HCAI beforehand? We will verify whether you're going to an eligible school during your application period. So when an applicant applies, they will obviously tell us where they're currently going or hoping to attend with our funds, and then as a part of our eligibility process, we will decide whether that school and program is applicable for the scholarship.
Thank you, Christian. Appreciate that. All right, next question. Will the award be for, let's say, the whole MSW program tuition, and not for just the first year tuition, like the former BH scholarship?
Yes, it qualifies for the entire year, not just the first year tuition. You'd be applying for the entire duration of the program.
Right. Angela asks, how will their obligation commitment be tracked and verified?
So we'll have their regularly scheduled check-ins with applicants and then grantees to ensure that they're working towards their education. And then, of course, once they find a job, we'll continue to verify that they're employed in an eligible setting, working towards fulfilling their service obligation. So there will be regular check-ins.
All right, thank you. Cassandra asks, would it be possible for us to get this PowerPoint emailed to us? Cassandra, I can answer that question. We are recording this webinar, and we will be posting the webinar and the slide deck together on our website within 7 to 10 business days. So check back on our websites, and we will have it up there for everybody to access. All right, next question. The award seem like this more restricted funding than other state-funded behavioral health scholarships with more years of work requirements. Which students do you think are best candidates for this program? How do I choose which program to apply to? State funding or these Fed-funded programs?
Christian, I think I might punt this one to you. I feel like you might have a little bit more point of reference as far as who the ideal candidate would be.
Yeah, so you're right to point out that this program is a little bit more restrictive on funds than some of the programs that we've administered in the past. The reason for this is the contract that we signed with the federal government that Andres was referencing earlier, called the STCs, where they made pretty clear that, for example, cost of living would not be funded through the program. We see the ideal candidate as the people who are incurring higher tuition and fees. So, for example, people in MSW programs, people in graduate programs that have high tuition and fees, would be it would be more beneficial for them to apply for them personally. Of course, we encourage everybody from every level of degree to apply, if they think that this program would be helpful to them. But we of course recognize that with lower tuition and fees at, say, community colleges and bachelor's degree programs, that it would be more beneficial for a lot of graduate people to apply for these scholarships.
All right, thank you. Let's see. Next question. What does the application consist of? Is there a written statement required or letters of recommendation?
So we'll have a grant guide that they'll, put in their information. No letter recommendation required here. It's just providing us with the information regarding the school they're applying to, the major, and a couple of other scoring questions that we'll have to ask, but it will be an application available on the website.
That leads to the next question. When will the grant guide be available?
So the grant guide, again, is available February 2nd, 2026, and will be open until March 16th.
Right. Looking for some additional clarification here from previous answers. So students currently in an MSW program can apply, but they won't be funded until after they graduate and get their ASW number. Again, how does the funding work if they're no longer students and registered with the university?
Can I take this one, Chris?
Absolutely.
So just to be clear, people are applying while they're in school. So we are funding people who are currently in school or about to be in school in fall of 2026. That's when this program funds things, from fall 2026 and onward. After somebody graduates, so that's after we've paid for their tuition and fees as it relates to their program and they graduate, then they're on the hook to get the relevant license associated with whatever they've applied for. So for example, if we're funding an MSW degree, we would expect them to, in some reasonable timeline that we will outline in the grant guide, to become an ASW, associate social worker, a licensed social worker, sorry, associate clinical social worker. So many acronyms in this program. We expect them to become an ACSW, and then we expect them to get a job. So that's the timeline. We are funding somebody currently in the program or about to be in the program in fall of 2026. At some point, we expect them to graduate in some reasonable timeline. Then on some reasonable timeline, we'll expect them to become an associate clinical social worker or whatever license or certification is associated with the job they applied for. And then on some reasonable timeline, we will expect them to get a job and serve their service obligation. And we will outline those specific timelines in our application and in the grant guide.
All right, thank you, Christian. Hopefully that clears up the journey. All right, Tiffany asks, can the funds be applied to a fellowship program in behavioral health post-licensure?
No, this scholarship is not intended for fellowship programs.
All right, next question. If we are awarded the scholarship and we have to meet the obligation as soon after graduation, what is the timeline? I ask because finding employment can be challenging at times.
We generally give a 6-month window for grantees to find a job post-graduation. That's generally the timeline that we subscribe to, but of course, special circumstances may require us to work with the grantee while they look for a job, but generally we stick to a 6-month window.
All right, thank you. Yesenia asks, how many scholarships are given in each cycle?
We don't have a predetermined amount. We have $96.9 million available for this cycle. Depending on the grantees, we might be able to completely deplete that amount, but we don't have a specific number that we are subscribed to as far as scholarships being handed out.
Thing we can say is with that amount, we encourage people to apply. All right. Is an MSW program in candidacy status for accreditation eligible? We are eligible for the BH scholarship.
We generally accept any program that is already accredited. I will ask that you reference the grant guide when that's released, as we'll have a complete list of all programs that are eligible, but generally we are only accepting programs that are currently accredited at this time.
Usually an individual working towards licensure after they have their master's degree does not have educational costs that are related to a college. They need to complete the training and have exam costs. They also may need to pay for their supervision, but it is not through a college. Could they still have financial support for these related costs? It could not be through a college.
So the scholarship does not cover any of those fees afterwards, but I would refer you to look out for the MediCal loan repayment, the MediCal BH Connect loan repayment program if it's post education expenses, but no, the scholarship would not fund those costs. That wouldn't be directly related to educational expenses.
Monica asks, the award date is past the students need to commit to a program. Will students receive some type of notification of the amount they may be awarded, thinking of students who may need the scholarship to attend university?
Yes, so they will be notified when we announce the award notifications. Specifically, we'll provide the amount that the student is eligible for, which of course, the timeline is a little past when the student might be able to commit to a school, but they will know the exact amount that they're eligible for that summer before starting the program.
Thank you. When you say service obligations, what does that mean exactly? Does that mean we have to work for a MediCal contracted employer?
So as long as it fits the criteria that's listed in the eligible settings, that would be fine for a service obligation. Those will be included in the slide deck and should be referenced in the grant guide as well. As long as the applicant post-graduation works in one of these settings, they would be working towards fulfilling their service obligation.
Right. So are there any opportunities that you see for community college students? Would, for example, MSW students working as interns at a community college be eligible? Would the student apply the graduate school or the community college?
So there's definitely plenty of opportunities for our community college students to apply as well. I will reference back to the slide deck as far as the professions. Many of those could be earned, their degree or certification could be earned through a community college. So there's definitely a place for those students to apply. For MSW students working as interns at community college, they could apply towards their program for their educational costs. For the MSW program, they would be eligible, but again, they would need to fulfill that service obligation post-graduation at an eligible setting.
All right, thank you. Jerry asks, are psychiatric technicians eligible to apply?
Hi, Jerry. Yes, definitely. Licensed psychiatric technicians are eligible for the scholarship program.
All right. Laura asks, if a community college student receives the scholarship, what is the grace period for the student to find a job in a MediCal facility?
So generally, we give a 6-month window for a student to apply and start a job post graduation.
All right, next question. I thought this webinar was for universities. Will there be a webinar for students that we can tell our students to attend?
Yes. So this webinar was mainly for our university folks, but we intend to have a launch webinar closer to the launch date of the grant guide for all students to attend and receive this information.
All right. Jerry asks, will the prerequisites to the degree be covered?
So this scholarship program is for the education needed to attain the license or certification to actually practice as the eligible role. So the prerequisites wouldn't necessarily be covered. It's just the program that's working towards that licensure certification.
Sherry asks, if they are unable to get their license, do they have to pay back the funds?
So those are part of the standard terms and conditions that we do require that each student works towards licensure and certification. Of course, each profession has a different timeline, but we do expect that the students work towards actually attaining that licensure or certification. Um, yeah.
All right. Next question. Thank you for the school requirements. If I am waiting to be admitted to an MSW program, can I still apply for funding for fall 2026? Most schools won't send out admissions letters until May.
Yes, definitely highly encouraged to apply. Again, the grant guide would open in February and close in March, and that would be for the start date of the fall 2026 academic school year. So yeah, definitely encourage you to apply.
Right. Let's see here. Um, Next question. For awardees, when will their scholarship funds be dispersed to the university, November or earlier?
So we're still working out the details on when disbursement would occur. I would anticipate that it would be prior to November of 2026, but we're still working out those details on a school-to-school basis.
All right. What about psychiatric technician students at community colleges with no licensure?
So we do accept community colleges as an eligible program for the student to apply, as long as they're working towards licensure or certification. So yes, psychiatric technicians are definitely eligible at the community college level.
All right. Next question. Can you share when the other state-funded behavioral health grant programs will open? Will the state programs have awards for fall 2026?
So we have a variety of BH Connect programs opening, spread throughout the next couple of years. Next year, we'll have this one opening, and of course, our community-based provider training program is anticipated to launch in March, which covers a bit of a more limited scope of professions, but that is expected to launch next year in the springtime.
All right, thank you. Can you share when the oh no, I already just asked that question. Next one. Uh, will the scoring criteria for applicants be similar to the former BH scholarship application?
Yes, so there will be similar scoring metrics that we'll be using for the students. Of course, there are some differences due to you know differences with the standard terms and conditions that we have, but there are similar scoring criteria that we will use for the scholarship program here.
All right, Jeremiah asks, can you please restate the scholarship application window?
Yes, so the scholarship will open on February 2nd, 2026, and will close on March 16 at 3 p.m.
Great, thank you. Rose asks, regarding the accredited program question, we already have candidacy status, i.e., are close to the award of accreditation, and all of our students will be considered as having graduated from an accredited program. The Business and Professions Code allows individuals to attend an unaccredited program. We only need to be fully accredited with the individual up. I think that's supposed to be when the individual applies to take the LCSW exam 2 years after they graduate. We are also an HCAI Suisse awardee. Could it be reconsidered that our students be eligible? We currently have 6 BH awardees.
Yeah, I'll take this, Chris. We're gonna have to take this question back. I don't think we can answer this live here because this is an internal discussion we're gonna need to have with our team. But we're gonna flag this. So, Rose, if you could actually email us this exact question at the email that we're gonna flash at the end of the webinar, so that we can get back to you. And also we'll have guidance on this in the grant guide because we're gonna have to discuss this internally as a team.
All right. Thank you, Christian, and thank you, Rose, for that question, and we will follow up. All right. Are there any resources for job seekers after graduation?
So we're not directly supporting any students in finding employment, but of course, you know, resources through the university or college attended could help students, but unfortunately, we're not able to directly connect students to specific employers post-graduation.
All right. Monica asks, if someone obtains their ASW and not pass their LCSW, will they need to repay the loan? Not all who take the exam pass. It can take many years to accrue hours to sit for the exam.
So part of the standard terms and conditions we have is that the individual does need to work towards their licensure. We can work on a case-by-case basis, but unfortunately we do require that the student work towards licensure as part of the scholarship program.
All right. Given the disarray we were observing at the federal level, where did that go? Okay, sorry, my screen just jumped on me here. Okay, given the disarray we're observing at the federal level, how secure are these funds?
Yeah, I'll take this question, Chris. So these funds are a contract that we signed with the federal government. Yes, it is subject to the federal government's ongoing approval, so we're going to be honest and upfront about that. But we've got no indication from the federal government that that contract or these funds are on the chopping block. In fact, in the new administration, we've received guidance that going forward, they wouldn't approve a waiver like this, but they have no plans to take away this waiver that we have to administer these funds because other states like Mississippi, Alabama, there are other states that are using waivers that just got approved for stuff like this. So considering that a broad swath of diverse states have these sorts of waivers, there is not interest currently in revoking these kinds of waivers for these funds. So we feel pretty secure, as secure as you can be. in the fact that we are going to have access to these funds going forward. But you're right to flag in this environment that we cannot 100% guarantee you that the federal government will continue to support these programs, and that's just us being honest. If somebody is in contract with us, it means we already have the funds, and the feds cannot, according to the contract, take funds away that we already possess and are already administering. So if somebody is receiving program funds in this year, when we get the funds and then we pass them to colleges, those funds cannot be stripped away. Only future funds can. And we have clauses in these contracts that make sure that students are not on the hook for service obligations unless they've actually received the funds that we are saying that we're going to give them for their tuition and for all our other programs. So our loan repayment program, if they haven't actually received loan repayment, they will not owe us a service obligation.
Thank you, Christian. Next question. Does the work obligation have to be in California?
Yes, it must be completed in California in an eligible setting.
Right. I'm going to give about 30 more seconds for any additional questions we have. These have been fantastic questions. We appreciate all of the interaction and attention that you guys have been providing us today. Wanted to mention that if we didn't get to your question today, that you can always email us at mbhsp@hci.ca.gov. We'll have that on the screen here in a minute. But looks like we are. Oh, we do have another question. Thank you, Laura. Laura asks, how do you determine the amount of money that each student receives?
So as part of the grant guide, we'll have each student submit their just basically sorry, we'll have them submit their invoice of the university, and depending on the profession and the funding requested from each student, we also take into account FAFSA and Cal Grant. We'll use that to calculate each amount for per student, and that would turn into the actual amount that will reward the student for the scholarship.
Thank you. All right, we got another wave of questions. Well, we do have time, so we'll keep going. If I have admissions to obtain my BSN, can I apply for the scholarship prior to starting the program? I mean to study nursing.
Yes, registered nurses are an eligible profession, so I highly encourage you to apply for the upcoming cycle.
Asks, can you provide examples of the PhD licenses that would apply here?
Thanks for your question. So I believe for the clinical psychologist, the PhD route is an eligible degree. But I again will refer you to the grant guide once released to verify the information. But I believe that is one that includes the PhD license.
Monica asks, sorry, I may have missed this. Will you distribute the slide deck? Yes, Monica, we are recording this webinar and we will be posting both the recording and the slide deck on our webpage within 7 to 10 business days. That gives us time to make sure that it is ADA compliant. Right. Can you put the email address in the chat? Yeah, we can do that. And then let's see. Yeah, next question. How many students can receive the scholarship?
Again, highly dependent on the number of students that are applying. For this upcoming cycle, we have $96.9 million available, but there isn't a set amount of students that would be that would qualify for the scholarship program.
All right. Let's see. Are direct entry MSN students being prepared for RN licensure eligible?
Yes, that is an eligible profession and degree pathway.
All right. Next question. There we go. Looks like we still need to get the message in the chat. So we are working on that. We will get that out for you. Laura asks, I am a community college instructor trying to determine which students would benefit most from this scholarship. It seems that transfer students might benefit the most because of the high cost of a four-year university. Am I correct in this assumption?
I think community college students can definitely benefit from applying, especially towards that third tier that might that depends on the amount received as far as tying that to the service obligation. However, for those higher paying expenses programs, it could make more sense for a four-year university or for a graduate level student to apply, just given the level of commitment of a service obligation. But I still encourage community college students to apply and see what their service obligation would be depending on the funding requested.
All right, thank you. Carrie asks, are private universities included in this?
Yes, private universities are also included in the scholarship program. Correct.
All right. Okay, well, we are nearing the end of our time today and are out of questions. Again, appreciate all of your thoughtful questions and active participation in today's Q&A session. And again, if we didn't get your question, please reach out to us at mbhsp@hci.ca.gov. And I'm going to hand it back to Angela for some closing thoughts today.
All right. Thank you, Chris. So thank you again to our fantastic team and for all of you for spending your time with us this morning. We do hope that you've benefited from this webinar and you've learned more about this important opportunity. We're hoping that you'll take this information and share it with your students in your networks so that you can help them make decisions about the next step in their education. Your support in spreading this word ensures that more aspiring behavioral health professionals can access the resources that they need to make a meaningful impact. So on behalf of our team, thank you again for joining us today, and I'll turn it back to Chris to wrap us up.
All right, thank you so much, Angela. And thank you again for joining us today to learn more about the MediCal Behavioral Health Scholarship Program. We're proud to offer this opportunity as a part of the BH Connect initiative and as a part of our broader efforts to strengthen California's behavioral health workforce. Before we wrap up, we invite you to explore the many resources available on our website to support your journey through the health workforce. Thank you again. Actually, let's go ahead and there we go. We'd love for you to check out again our website, also all of our socials. Please follow us on your preferred platform, and we would love for you to tag us on anything that you have going on in regards to improving California's health workforce. One of the best ways that you can stay in touch with us and keep up to date with what's happening is for you to sign up for our monthly health workforce updates newsletter. You can go to this website right here or click on subscribe at the top of our website. And in that list of checkboxes, click on anything within the health workforce section and you will be added to our mailing list. We do have a BH Connect helpline, and if you have questions or need help or have students that need help, please direct them to this phone number, 916-326-3899, and they can answer all of your BH Connect related questions. And as promised, here is that email address, mbhsp@hci.ca.gov. And please email us at any time about your questions for this program. Well, thank you so much for attending. We appreciate your time and interest. Please stay tuned for more information about the MBH Scholarship Program. And with that, we do conclude today's webinar. We hope you have a wonderful day.